Hi, it's Dr. Story. Why can't you adjust yourself? This is a common question people ask. Sometimes patients will ask me, oh boy, I wish I could adjust myself, or I wish I could crack my own back, or I crack my back all the time. Or here's a fun one, Dr. Story, do you crack your own back? The answer is no, I don't crack my own back, and I wouldn't, and I'm going to tell you why. There's a fundamental difference between what you're trying to do and what I'm actually doing. When you look at the actual spine, what I'm showing you right now is this is the front of the spine, this is the side, and this is the back. These little bumps right here are the things that you can feel on the back of your spine. So you're looking at the back of the spine. Now, I'm going to open this up to show you that there are things called discs, which are in the front, and there are facet joints in the back. The most important difference between a proper chiropractic adjustment that works and a manipulation that people try to do by twisting their spine is one of those things is the effects on the facets. Now, if you were to try to rotate, and I want you to watch this facet right here, if you were to try to twist your spine and rotate, you open up and pull apart this facet. The problem is that you're jamming the other side. So in effect, what happens is when you do this, the bone itself is stressed in a backwards direction. So what ends up happening is you have two bones like this, and as you twist it, because the facets are jamming on one side, so if you turn left, you're going to jam the right facet. If you turn right, you're going to jam the left facet. So as you do that, it's almost kind of like you're wiggling the bone in a backwards direction. What this does, it produces a tremendous amount of stress on the actual capsule or the ligaments that hold the joint together, and therefore you continue to get stress there. That's why when you crack your own back, it feels good because it releases endorphins and it kind of opens up the facets on one side, but because there's a chronic ligament strain, you always feel that tightness. And so most people will try to crack their own back and then end up years later cracking their back 20 times a day in an effort to relieve it. Now, why is it that a person can crack their own back, then they come in and see me, I start actually adjusting them, and they stop having that need to crack their own back? Here's the reason why. The reason why is because instead of me rotating side to side like that, the primary motion that we use in my office, as most chiropractors that I know do this, is we will adjust in a backwards to front direction. So as we correct the spine, we will actually be putting either our hands on the spinous process, which is this bump here, or what we'll do is we'll use an instrument. And by using the instrument and pushing it forward, we actually create a normal, what's called lordosis, or a normal curve in the spine. The facets actually then approximate and come together in a proper alignment, and then there's less stress on the ligaments that hold the facets together. As the body heals, then you feel less stress on that area. So actually, it sounds very subtle, but it's not. But the difference between a manipulation that most people are trying to do themselves by twisting and rotating their spine and getting all those cracks is you're actually creating more strain there by pushing the bone in a backwards direction. A chiropractic adjustment pushes it from back to front, and that's why there's so much relief that occurs when we do an adjustment. So I hope this answers the question of why I do not crack my own back. Nobody has the leverage to actually do a proper adjustment. I personally never try to twist my back and make cracks happen. I don't think it's a good idea. In fact, it feels good for 5 minutes and then you start having more chronic problems. So I do not do that myself. I have to go to another chiropractor to get my own adjustments. I do not recommend that patients try to crack their own backs, although they think it's benign, so they just kind of do it. But as you start to treat people, and after about 5-10 treatments, you ask people, so, are you cracking your back as much? And they go, no, really, I don't feel the need for it. And that is the true meaning of a healthy spine. So I hope this was informative to you. I would recommend that you try not to do that. Find a chiropractor in your area that can do adjustments from back to front. And if you like this video, give me a thumbs up, subscribe to my channel. And if you know anybody that's cracking their own spine constantly and they're doing these things to their neck, go ahead and forward this to them and give this information to them. It may actually save them from having a spinal surgery in the future. And if you have any questions or comments, just answer them below and I'll be happy to answer them. Thanks for watching.